Good evening. Thank you for joining us for our poster presentation this evening. I'm Faye Grimsley. I'm the department head and associate professor of public health sciences at Xavier University of Louisiana. Our poster presentation this evening, HBCU's response to COVID-19, adopted policies and practices. Some of the key issues. Black Americans experience some of the highest COVID-19 mortality rates across the United States. And what types of services and prevention and mitigation strategies and policies were implemented by HBCU campuses to meet the challenges of COVID-19 were very important, because some HBCUs are actually located in areas hardest hit by COVID-19. It was important for administrators of HBCUs to make decisions about campus reopening. It was also important for parents to have as much information as possible so that they could make decisions about if they were going to send their children back to Xavier's campus. And we can see, as of last year in June, we know that we had many cases of COVID in several of our Southeast states: Texas, Louisiana, Mississippi, Alabama, Georgia, South Carolina, and Florida. And we also know prior to the COVID-19 pandemic, we had inequities in the Deep South as well, as you can see on this map. And corresponding to some of those high cases and inequities, we see this is where most of our HBCUs are located, in the same area along the Gulf Coast and some of the Deep South area. Documented protocols, practices, and policies and procedures. And so we saw a number of written protocols and policies were consistent with the CDC guidelines and good public health practices on HBCU campuses. Screening and testing information was readily available and easy to find for some HBCUs on their websites. Some websites actually required login to assess symptom checkers. And the amount of COVID-19 information provided varied by campuses. Some of the protocols actually ranged in 4 pages all the way up to 60 pages. We also saw Yale University College of Medicine rated COVID-19 dashboards for colleges and universities. They looked at how much data was shared with the public. They assigned a letter grade to 369 COVID-19 dashboards. Very few received an A+, no HBCU received the grade of A. Some HBCUs did not have a COVID-19 dashboard. And I'll ask you a review of some of the HBCU websites in the Southeast. We focus on most of the HBCUs in the Southeast. And you can see that some did indicate that they had a COVID-19 dashboard. They did follow the safety protocols according to the CDC guidelines, as far as the social distancing, the mask requirements, and some even had some of their classes hybrid classes as well. And with this, you can see that all participated and had the necessary protocols in place. And some of the campuses actually did their own testing for COVID on campus themselves. And some additional colleges that we looked at in the Southeast, they did have the COVID dashboard, and some did not have the COVID dashboard. Some did not indicate that they were actually following the safety protocols as far as the social distancing and mask requirements, but that doesn't necessarily. You can see for the Lane College and you can see for the Finelander Smith, that was the case, but that doesn't necessarily mean that those colleges were not following those protocols. It's just that in our review, we just could not find that information on their website. So protocols and procedures, the adopted conclusions. Some colleges lacked testing data because campuses were reopening in spring of 2021. Policy and procedures adopted were consistent with CDC guidelines. The documentation of the policies were on websites, standalone written plans. Some also included the information and updated the student handbooks. They updated the staff handbooks. Some even created frequently asked questions and posted that on their websites. Some of the recommendations for future directions for the protocols and prevention: continued COVID-19 vaccination and testing. The documentation of these vaccination and testing protocols is very important. Testing is needed to identify ongoing infected students, staff, and faculty on HBCU campuses, and continue to seek out collaborations for sustaining these established and adopted protocols and practices. Acknowledgements for our project: Destiny K. Buraimoh, one of our MPH Health Equity students; Leah Bishop, one of our BS Public Health Sciences students, and some of our staff that participated on the project, and some of our faculty that participated on the faculty. We have our staff, Ms. Tammy Hall, Ms. Lanisha Nash, and Dr. Marjorie Belizaire, and we have our faculty, Dr. Krista Mincey and Dr. Amy Thierry and Dr. Regina Benjamin. Our references for the project. And thank you for watching and participating in our poster session on this evening.